Hi, I'm Nishand from Malaysia, a fellow student of Prof.Bancha. I'll be presenting on arthroscopic infraspinatus rotator cuff repair using blended suture bridge technique. This is a 74-year-old Thai gentleman with a history of trauma following a motor vehicle accident, where post-trauma he complained pain over right shoulder and limited range of movement. On inspection of the back, there's obvious infraspinatus muscle wasting in comparison to the opposite side. His external rotation stress test is positive with a positive leg sign. Pate test is negative for him, showing good strength of teres minor muscle. Patient also have difficulty in elevating his arm, where he needs assistance for full abduction. The Jobs test is positive on the factor side. There's no tenderness over biceps tendon. This is a Rockwood X-ray film showing an acromion spur. This is the MRI T2 image of axial view showing infraspinatus tear. MRI image on the left showing partial articular-sided supraspinatus tear, and on the right it shows fatty degenerative changes grade 2. Now let's start the arthroscopic surgery. After positioning the patient's beach chair and dripping is done, we now proceed with skin marking. There are 4 main portals that are used. It's the posterior portal, the anterior superior portal, the lateral portal, the portal viewing. First we create the posterior viewing portal. Next is the creation of the lateral portal. Start with subacromial decompression from the lateral portal. An acromion spur is visualized. The bony spur is shaped using a burr till the level of distal clavicle. Next, we proceed with subacromial decompression and clearing of the spur from the posterior portal. Fraying fibers on the cuff tendon are debrided using a shaver. Now we are creating the portal of Wilmington, which is a posterolateral portal. Next, we start the debridement of the infraspinatus tear using a shaver. Now the tear is able to visualize clearly. Soft tissue is then cleared till teres minor is visualized. As we move towards the quadrilateral space, axillary nerve and posterior circumflex artery can be seen. Intra-articular view shows intact subscapularis and biceps tendon. Microfracture is performed over footprint from the posterior portal. Next, we create the anterior superior working portal. Microfracture fracture is then continued from the anterior superior portal. The first ankle suture is inserted over the most anterior part of the medial footprint. The second ankle suture is inserted posteriorly of the medial footprint. A suture passer is used to pass the PDS suture through the most posterior part. Then, first black tiger suture is passed using the PDS suture. Next, a suture passer is used to pass one black tiger and one blue tiger via a PDS suture. A suture passer is used to pass PDS suture. An active bond suture as a relay suture is used to pass two solid blue and one blue tiger. First pass is used to pass an active bond suture for relay later. Active bond is used to pass one black stripe and one solid blue suture. A suture passer using a PDS to pass one black stripe and one blue stripe suture. Next, a PDS suture is passed using a suture passer. This PDS suture is then used to pass one blue solid and one blue stripe. The posterior black tiger sutures are tied together at the medial footprint. Next, the blue tiger sutures are tied together over the medial footprint. One limb of each sutures are brought together for the first lateral row anchor. Next, we identify the location of the first lateral row anchor, which is posterior to the bicipital groove laterally. The first nodular suture anchor is then inserted and screwed and secured. Sutures are equally distributed to increase contact pressure on the repair. The sutures are then tensioned, screwed, and finally cut. The remaining sutures are brought together for the second lateral row anchor. Next, the second nodular suture is inserted with the remaining sutures. Sutures are also equally distributed for uniform compression and to increase contact pressure. After tensioning, knotless anchor is then tightened and the sutures are finally cut. This is the completed repair of the calf using the blended suture bridge technique. This is his post-op check X-ray. This is the post-op MRI after treatment. Showed good healing of supraspinatus and infraspinatus muscle. 6 months after surgery, his range of movement is full. Good supraspinatus muscle strength, good external rotation, and there is no extension like seen.